Alicia Keys, 105.1 The Buzz with Daria, Mitch, and Ted.
I have, well, let me first introduce Dr. Dave Gilkey. I'm sorry, not Gilkey.
Magilke.
Magilke. Okay.
Dr. Magilke.
That was close.
I smell like you. No, well, I'm distracted because I went to, I'll explain who he is in a second. I went to give you a hug, and I give you like a really good one.
Uh-oh.
And now my shoulder smells like your cologne. That smells awesome.
Watch
It's
out.
hand sanitizer, actually.
That's even better. No, this is definitely, well, it must be somebody else I hugged. But anyway, my shoulder smells excellent.
Fantastic.
Okay, so let me explain the chaos in here. You can't tell it's chaos because everyone's being really quiet.
Oh, it's
but
bedlam.
It's insanity.
Nuts.
Dr. Lee Robinson is sitting directly to my right, and where Ted would normally sit if he wasn't on vacation is Dr. Dave Magilke.
Right.
Now, you guys have known each other since high school, right?
Well, we went to the same high school.
Yeah.
But he's significantly younger. You can tell he doesn't have any gray
We
hair.
graduated the same time, though.
I didn't want to mention it.
You did?
Well, that was a small detail we weren't going to go into. No, Dave's 7 years younger than I am.
Okay.
So he wasn't there when I was here, but he did graduate from Aloha High School. Go Warriors.
Yeah, Ted's
can
alma
you believe
mater.
it?
Was that Warriors?
Yeah, Warriors,
Okay.
yes, Warriors.
Well,
Yeah, Ted went there too. I keep
Sure
forgetting.
did, yep.
oh my God, really?
Isn't that crazy? Like,
Yes.
like 100 years after you guys.
Close.
Well, here's what's happening.
Yeah.
Dr. Robinson, who has been a guest of ours on the show since
Like 6 years.
like a crazy long time,
Yeah.
like 6 years, who I've known for like 15 years, is retiring.
Well,
No, is that
in
how
some
you wanna
ways.
put it? Okay,
well,
clarify because I don't want to get
you
the
know, I'm going
terminology
to
wrong.
clarify because
He doesn't like working on your faces anymore.
He's sick of your faces.
He can't stand your faces.
No more ugly people.
there's plenty of people out there that need a lot of work. Let's just put it that way.
No,
Great.
but what's happening?
The issue is that I'm sort of having to go on a extended, I would call medical sabbatical,
Okay.
because of it basically boils down to a congenital or hereditary spinal disorder in my neck that needed to be operated on a number of months ago. And subsequent to it, and just before that, I was having numbness in my dominant hand. And subsequent to the surgery, it hasn't resolved, and it's going to be a while. It's going to be quite a long time before that numbness eventually resolves with about a 75%
Success rate?
success or potential. I
Okay.
mean, the likelihood is it will get better, but it's going to be a while because these nerves have to regenerate from my neck down to my hand. They regenerate about an inch a month, and my arm is, I don't know, a couple of feet long. So do the math.
Mitch regenerates about an inch a month.
Thank you.
There you go.
Wouldn't that be nice?
Essentially, for a surgeon to have numbness in his hands
Doesn't work.
It
Well.
doesn't
So great.
work in the long run. You know, if you've been doing this work for a long time, which including residency has been 29 years, you get to the point where, I mean, if you had to do surgery with half of one hand, you could probably do it.
Yeah.
If you had to do it. But the
Right.
problem is that what we do, what Dr. Magilke and I do,
It's not life-saving.
it's not life-saving, but even when all of the variables are lined up perfectly, it's still technically a challenge to do this well.
I mean, one sneeze and you can end up with Ernest
Well,
Borgnine's nose.
I wouldn't go that far, but you really, in the patient's interest, is you want to make sure that all of the variables that are out there are aligned.
Sure.
And it's to be operating sort of with half of a hand that really doesn't feel quite right. It's in the long run just not good, and I can't continue to do it safely on patients, and so
Well, that says a lot about you,
Well,
too.
luckily
yeah, he's just digging for compliments, isn't he?
So far, no, not so. I'll get there.
Okay.
I'll get
Okay.
there. No, I luckily I've known Dave, Dr. Magilke, for a number of years, and he's an excellent surgeon, and we've traded call, and we've taken care of each other's patients and that sort of thing, and because I'm not able to operate on patients, I need to transfer the care of my
Someone you trust and
to
respect.
exactly.
Right.
I mean, there's a
Yeah.
lot of people in town that I would not have gone there
Yeah.
with, but I feel confident and blessed that I at least know my patients are going to be well taken care of.
If I poked your hand with a pin right now, would you feel it?
It depends upon how big it was.
Staple it.
And
Get the
how
stapler.
hard you impaled it. But
You have a younger brother.
It does feel weird.
Yes, she does. She certainly does.
Can't you tell?
And when he's not here, I'm the substitute.
Okay, so we're gonna miss you so much.
Yeah.
But we've talked to Dave. We like him a lot. I'm
I
not
know.
saying we,
I know.
I'm not
I
saying-
like Dave better.
The
I know, I didn't
gloves
wanna
are
say it.
coming
I didn't
off
wanna
right
say
now.
it.
Do you have a boat, Dave? Do you want a boat?
Oh, no, I can.
Well, could you think about getting one? Because Dr. Robinson has a boat. Dr. Workman has a boat.
I could, I
Okay.
guess.
Good luck into it.
Hey, Dave, do you want to buy a boat?
It was a little less, but close.
Where do you now? I know that Dr. Robinson's practice was on one side of 217, and if I'm not mistaken, yours is just on the other.
Yeah,
like
exactly.
On the other end.
It's kind of funny. We're on the extreme ends of 217. I'm at St. Vincent's Hospital, so right where 217 and 26 meet, and then Dr. Robinson was at the Mercantile Village, at the opposite end of 217. So,
Right.
So we're connected by a really awful freeway.
Have you always practiced in the Portland area?
Yeah, I have. So basically, I came back to Portland in 1996, and I basically grew up in Oregon. Like I say, Dr. Robinson and I both went to the same high school. I went to Oak Hills Elementary School. I mean, there's a long
No
history.
way, Oak Hills? Oh my gosh.
You went there too?
No, I did not go to Oak Hills, but I grew up on a farm that was a
Had a
mile and a
hill.
half from there.
Oh yeah, was it a strawberry farm? I might have picked strawberries.
No, that was the Wismers.
Oh,
This is just
Oh,
beautiful
yeah.
nostalgia.
I did pick strawberries at the Wismer farm.
Oh.
Yeah.
No. See, my father has this really good ability to always pick a house that is potentially in the busiest street. So we lived on the corner of West Union Road. So I went back to see my old house, and there's a 4-way stop light at the
Oh
corner.
my
where I was.
gosh.
Oh, near
great family
the
home.
Little Red Schoolhouse that was there for a number of years.
Yeah,
I have no idea what area.
Kinda close to
I
there.
can't
Yeah, right-
picture,
right
I
by-
can't
See?
picture
There you go.
any of this. I can't picture. So wait a minute. How old are you?
I am 48, almost 49.
Okay, that's all right. For a second, I thought you were younger than me, and I was gonna.
That we won't allow
freak
that.
out.
No.
Like a plastic surgeon in practice for 17 plus years. I'm like, hold on, what have I done with my life? I
We're failures.
I gotta reassess everything all of a sudden. Do you have a favorite procedure to do?
Actually, I like doing all of them right now. Right now, I'm really liking doing facelifts, and it's kind of interesting because it seems like every woman hates their neck, and a lot of men. I mean,
Yeah,
so
I
all of
hate
a
my
sudden
chins.
you give back somebody their neck, and they love you.
How about jaw lines?
Yeah,
Can you fix a
jaw
jawline?
lines, necks. I mean, they're all kind of. It's sort of interesting because when the procedures that both of us did a lot of were facelifts, and really facelifts have all kinds of great marketing terms, neck lifts or jaw lifts or chin tucks, but they're all basically things that improve your jawline and your neck are all facelifts.
Oh, I'm gonna like you so
You were
much.
gonna like you a lot.
Listen, it's just the,
Yeah.
but I've never had a jawline.
You
You know
have a
what
nice
I mean? No, I
jawline.
really don't have a jawline.
I think she has
It's
a
like
jawline.
speaking of Muppets, it's like Beaker. Like it goes from chin effortlessly
I
into
don't know
neck
what you're talking about.
with nary a bump nor
Not
ridge.
True.
So, would you like to come on and talk to us every so often about plastic surgery and take some calls and meet some people and have a great time?
Yeah, no, sounds fun. That's the call coverage I'm doing for Dr. Lee Robinson while he's recovering.
There
Perfect.
you go.
Hooray!
And the
Okay.
people that call in are fun.
And they're
I'm
polite.
telling you, we have had.
We have some good questions.
We
We stumped you
we've
one
never
time.
had really any weirdos.
No, we had somebody ask
Have
you about
we?
a laser
Oh,
bra or
there you
something.
go.
That was the one time I got
That's
stumped.
the only time we were stumped.
I
Laser
did
bra?
get stumped. Somebody asked what a laser bra was. We had to look it up because I was like, I have no
Uh-oh.
I
idea.
don't remember. Was it a thing?
No, it was a technique of doing a breast lift using a laser to make some of the incisions. It was all, and so it wasn't anything.
If we had had more time, if we knew that this day was coming, this sad yet happy day, we would have put together like a retrospective. because
Dr. Robinson's highlights.
Yes, it's like duh, and sad
There
music,
aren't any
like, and
highlights.
remember-
Oh,
there
they're all
are some
highlights.
Let me see. I remember the time that your wife drove you. And you guys both stopped off, and you had a martini, and then you came in, and you're massive lightweight. So one martini meant that you were like going to sit here, and you're like, out of nowhere, on air. He goes, "I love Valerie."
Well, I do. She's the most amazing woman in the world.
light
Are
of
you
your
kidding
life.
And
me?
you knew that she was in the car listening. You're like, I want to tell you something about that woman in the car. That woman is my life. That woman is my everything. She is so beautiful to me.
Wonderful.
Well, you've seen her.
Lovely.
You've seen her. She is not the most.
I
She
agree
is.
with you all the time. That was one of my
Striking.
favorite
Yeah,
moments.
okay.
A couple of times you got tongue-tied of something like I would say to Mitch off air, and then we'd quickly go on air, and you'd be left like this. You guys don't know what's going on. Man,
That's almost every
from
Yeah.
show.
Dr. Robinson, the phone. Well, when you started here, you were like just young and full of life and energy.
Innocent.
I was
You had
young
dark
back
hair.
then.
Naive.
You had smooth skin, wrinkle-free.
It's amazing. Hey, time.
Out with the old.
We aged you.
Yes, out with the old, in with the young. We can't have too much gray hair around here. So it's time to.
Dr. Magilke is like, he's sitting up straight. He's got a tie on. He's got a blazer, a crisp white
Looks
shirt.
like a doctor.
Look at you. You're in like a Columbia fleece. You're in some sort of cowboy shirt.
You're in
There's
sabbatical
There's
mode.
a coffee
Boots.
stain on
Nope,
you right there.
that's
I think
from the dog.
I see some dog hair.
Oh, I had plenty of dog
Just
hair.
doesn't care anymore.
You look awesome, Dr. Robinson.
Well, thank
love
you.
you.
I can always depend on Mitch to
Yes.
boost me up
Right.
when I come in
They're
here.
just dragging you down. We love you. We're going to miss you terribly.
Yeah, we really
And,
are.
Well, I will be around. Maybe
no, I
someday
know.
I will just like pop in.
Do it.
and start slicing.
Oh, well, no, you don't want me to do that. I'll just start talking.
You're welcome anytime.
Dave, what's your website? Can I call you Dave, or do you
yep,
prefer
that's
Dr.
fine.
Okay.
You
You
know-
just seem like a Dave.
Yeah, it's funny because we used to try to use my last name, which is Magilke, which nobody could pronounce or spell. So it's actually www.portlandfacedoctor.com. How's that for catchy?
That's pretty good.
PortlandFaceDoctor.com.
And we've actually got a Twitter, portlandfacedoctor.com.
Do you tweet, or did someone do it for you?
Yeah, I don't really know.
He's just like me. I don't tweet, but I think
You have people.
I think I do have a Twitter.
But you
I've got a
trust
Twitter
the
account.
people that tweet for you.
Yeah.
Oh, they're great tweeters.
PortlandFaceDoctor.com.
Correct, yep.
That's better than yours.
Well, I don't.
Well, Lee
hey,
Robinson, you remember that, for
Nothing. Everything just gets better with time.
Oh,
As
gosh.
this show.
Oh, boy.
So
Oh,
true.
man.
Okay, so we say goodbye and a fond farewell for many, many years of hanging out and having fun. Those days are gone.
Long gone.
I know. What can I say? But you know what? This has been one of the funnest things that from a non-surgical standpoint,
Yeah.
probably the highlight of being in practice has been coming down here. Initially I came down here every week.
Right, it was
Every
every
week,
single
every
Wednesday.
Wednesday. And Wednesdays were very busy operating days. And it was sometimes just like, oh my gosh, do I have to drive down there? But the minute I would get here, it really was never a chore. It was always fun. Always enjoyed it. You guys made it fun, and you made somewhat dry topic actually entertaining.
We try.
Well,
And we've learned a little something along the way, haven't we?
Well, you both have.
I know more about terminology than he does. I'm telling you.
I think you both have some graduate degree type of.
I
You've
feel
earned it.
strongly that I could perform surgery on Mitch if I needed to.
We would love to see
I
that.
could do an
actually.
otoplasty with the best of them. I can do some ears. We got somebody on the hotline that wants to say goodbye to him. I think
Okay.
it's our buddy.
That's fine.
Ted?
Hello.
Is this Ted?
Hi, Dr. Lee.
Hello.
Doesn't sound like
Hi.
Ted.
No.
It is me. I swear it's me. I'm on my little headphone thing. I was trying to get down there in time to say goodbye in person. I may get there, but not on the air.
Have you been drinking?
No, but I went to go see The Hobbit, which is 7 hours long. So
Oh, well, that's the equivalent of at least 2 or 3 martinis. I'll tell you.
But I just wanted to take a moment to say on the air goodbye to you, at least as a regular guest on the show. I was probably the biggest cynic when it comes to plastic surgery and that sort of thing, and you have turned me around completely. And I am going to miss your camaraderie on the air and you're seeing you every couple of weeks.
Well, I appreciate that. I really do. Thank you for calling in.
Thanks, Ted.
Ted's small heart grew 3
I
sizes
know.
that
It's
day.
a Christmas miracle.
Dr. Dave Magilke, we look forward to seeing a lot more of you and getting to know you
Yeah, me
and
too.
having fun with you.
Thanks very much.
And with that, we'll be right back.